Considering a bone conduction implant assessment? Hope beyond hearing aids. Have you been told that a bone conduction solution could be the next step for you or your child? You probably have lots of questions. This short video will explain bone conduction hearing and how it can help. Most hearing comes from sound waves travelling through the air. However, some people have a condition in their outer and/or middle ear that stops sound travelling this way effectively. In addition to hearing sound through the air, we also sense sounds from vibrations through our bones. This is known as bone conduction. A bone conduction hearing device takes advantage of this natural process and may help when hearing aids are insufficient or unsuitable. The system is made up of two parts: a sound processor worn on the side of the head, and an implant either under the skin or through the skin. They work together by converting sound into vibrations, which are then transmitted through the skull to the inner ear, bypassing the outer and middle ear. The technology behind bone conduction devices has been around for over 40 years. Research has shown that they can help people to hear better, giving them improved sound quality as the sound bypasses the damaged parts of the ear, better understanding of speech in quiet or challenging environments, such as school, work, or restaurants, less chance of repeated ear infections as the ear canal is kept clear.
Prior to having my bone conduction device, my family would have conversations and I was not part of it. I can now be involved in those conversations and I enjoy meeting new people. The difference was like day and night. I only regret I didn't do it sooner. It's changed my world.
You may have questions about bone conduction devices. Here are a few of the most common ones. Is it a big operation? It is routine surgery that usually takes less than 40 minutes under local or general anaesthetic. Am I the right age for a bone conduction device? Bone conduction devices are for people of all ages. Your hearing health is important at any age. What types of hearing loss can bone conduction help? Bone conduction devices can be considered for the following: conductive hearing loss, mixed hearing loss, and single-sided deafness. If you go forward for an assessment, the clinical team will help you to understand if a bone conduction device could be right for you. How visible are they? The external processor is discreet, worn on the side of the head, and there are different options and colours available to suit your lifestyle. Are they available free of charge? For those who qualify, bone conduction devices are provided on the National Health Services of the UK and Ireland for one or both ears as appropriate. If you would like to find out more, you can be referred for an assessment to a clinical team that provides bone conduction devices. An assessment gives you the opportunity to talk to healthcare professionals and ask more questions. It will involve a variety of tests over a couple of appointments. Part of the assessment includes trialling the device with a headband. This enables you to experience hearing through bone conduction before deciding on surgery. Children, and some adults, may stay with this non-surgical solution for some time. An assessment does not mean you have decided to get a bone conduction device, but does allow you to explore your options for better hearing.
The referral process for my son Ross was very simple. The team took their time to ensure we both understood what was involved. Ross underwent a trial, the headband, and we felt well informed at every step. Surgery was under general anaesthetic and was very straightforward, moving a few weeks later to activation day.
Following the assessment, if a bone conduction device is right for you or your child, the next steps would be a routine surgical procedure, being fitted with your device a few weeks after surgery. The device will be adjusted to meet your hearing needs, and you will be ready to embrace a new world of sound. Could a bone conduction device be the next step for you? Talk to your audiologist about a referral. Learn more by visiting www.cochlear.com/UK.